class, this is Lynette Williamson. I wanted to provide you an audio video to accompany Chapter 1 lecture notes going over some specific information. If you look at Lesson 2 in your course, you have several links here for the lesson. You begin at the top, of course, with the Lesson 2 Start Here button. But if we look at the Chapter 1 lecture notes, this is highlighting specific information found in Chapter 1 of your ICD-10 PCS and Applied Approach textbook. In your textbook, you're given information on the history and the background of ICD-10 PCS and the benefits of this particular classification. Several things I wanted to point out, including the first one is the code format. ICD-10 PCS codes are 7 characters in length. They're alphanumeric. There is no decimal point, so when we look at a comparison between ICD-10 PCS and ICD-10 CM, in ICD-10 CM there is a decimal point, but there is no decimal point in our PCS codes. Also, all of the alpha characters in ICD-10 PCS are in capital letters, and there is no usage of the capital letter O. So to avoid confusion between O and 0, the classification system as a guideline or as a rule does not use the capital letter O. So this code here in the lecture notes and on the screen is delineated as 0TL70ZZ. So it's important that you note that when you are writing or typing your codes in general and in this class that you're using capital letters for your alpha characters and you're typing a 0 on the keyboard or in your writing. There is a difference between a 0 and a capital O on the keyboard, and the computer does recognize that difference when you're in the course and entering your codes for a graded event. Additionally, all of the components of an ICD-10 PCS code have a meaning. Each of those characters have a meaning. The first character, for example, reflects the section of the classification system that you're coding from. The second character reflects the body system of the patient that the surgeon is working on. The third character is a very important component of the ICD-10 PCS coding process. The third character reflects the root operation, the basic root operation, the objective or the intention of the procedure, and that is part of your coding process, is reflected in the third character. The fourth character value reflects the body part that the particular surgeon is working on. The second one is body system. The fourth character is body part. So the body part would be the liver, the heart. Body system would be such things as the GI system, the digestive system, etc. The fifth character value reflects the surgical approach for that particular operation procedure and how it was done. That's what the code is reflecting. The sixth character reflects devices. And when we look at the guidelines for ICD-10 PCS, we note that the sixth character reflects devices that are left in the patient at the conclusion of the procedure. What the sixth character does not reflect typically is devices used during the procedure. So if an endoscopic device is used, that's actually going to be reflected in the surgical approach. It's not going to be reflected in the sixth character value. If a retractor is used during the procedure but is not left in the patient, that would not be a positive value that will be reflected in our sixth character assignment in our final ICD-10 PCS code. So be careful when you're looking at your device characters that you are reflecting things that were left in the patient. Sutures, minor elements are not reflected. So it would have to be something like a Jackson Pratt drain, possibly like an artificial joint. Those types of things would be something we would reflect as a device being noted in the ICD-10 PCS code. And then the seventh character value is a qualifier, which is unique to certain codes and means certain things in certain sections of the ICD-10 PCS classification system. The very first section of the classification system is the medical surgical section that has 31 root operations. Those 31 root operations are defined out for you in Chapter 1 of ICD-10 PCS and Applied Approach textbook. You should be familiar with them. You do not have to memorize them, because while you are coding, and if you are not allowed to use your textbook for an assessment, for a quiz or exam in this class, for example, you still have the definitions of all the root operations in the front of your ICD-10 PCS coding manual. So you need to use the coding manual in fully as you are coding, especially for your graded assessments like your quizzes or exams. For your assignments in this class, you have the ability to use both your textbook and your coding manual. But again, you are not memorizing these root operations word for word, but you should be familiar with them, and your textbook groups them into certain categories, and that's how the Chapter 1 is given out to you, and also the following chapters. And this is just to help you organize your thought process. You don't need to memorize these groupings either. So in addition to the root operation component of ICD-10 PCS, the other important component of coding in this particular system, classification system, is the surgical approach. So in your textbook in Chapter 1, they gave you pictures of the surgical approaches, and I just replicated that here just for illustrative purposes during this presentation. There are 7 surgical approaches. The first one is open. An open surgical approach means cutting through the skin or mucous membranes and can typically involve going down through more than one layer of skin and muscle. This illustration here is an open incision, which is a cutting into, in this case, to remove the patient's gallbladder, also known as an open cholecystectomy. So this surgeon is doing a rather significant cut into the patient's body to get out this patient's gallbladder. The second surgical approach noted in your textbook is a percutaneous. Percutaneous is really highlighted by the fact that the surgeon is doing a puncture or a minor incision and then putting instruments through that. In this case, a needle. In this case, most likely injecting something into this patient's nerve in their face near their ear. But as you can see here, this is a very minor incision or a minor cut compared to the open cut of the open incision surgical approach. One of the things about number 2 in terms of percutaneous is just the fact that the physician is making this minor incision. The fact that he's using a needle is not part of the surgical approach because a needle is not required. The physician could just make a small cut, maybe to go in and grab something out of the patient's skin, such as a foreign object or something like that. So the needle is not part of this particular surgical approach or required. However, in number 3, when we look at percutaneous endoscopic, by definition, the physician has to make these minor incisions or punctures and then use an endoscopic device. And that's illustrated here in number 3. We have a picture of a patient having their gallbladder removed laparoscopically. In this particular procedure, there's 4 minor incisions made, 1, 2, 3, 4, and the 4th one is going through the belly button. This is the belly button of this patient, and this is where the patient's gallbladder will be taken out through. So they're using 3 incisions to stabilize and elevate the patient's liver, and then they're going in underneath and pulling out the gallbladder. But the endoscopic component is required for this particular surgical approach, meaning an endoscopic device. The 4th surgical approach is via a natural or artificial opening. For the most part, you will be seeing surgical documentation where the physician is going through a natural opening such as the mouth or the nose or the other natural openings of your body, which are related to the urinary system, the GI system, and of course the reproductive system. This is an example of an endotracheal intubation where the surgeon or the physician is going through the patient's mouth using this device to then insert a tube. This usage of a tube is not required. This is the the surgical approach is just reflecting the fact that the physician went through a natural artificial opening. He could have went in there to retrieve something such as a foreign object. However, in the next surgical approach, which is via a natural or artificial opening endoscopic, the use of an endoscopic device is required to reach and then visualize, in this case, the bladder of the patient. So this one, again, the word endoscopic is required, or an endoscopic device. The next surgical approach, number 6, is we also going through a natural artificial opening, but the endoscopic devices are done via a percutaneous incision, so the small minor incisions, and they are also assisting. So this is an example of the physician going through a natural opening, which is the vagina of the female patient, and then also using laparoscopic instruments, in this case with 4 additional small incisions, and this would most likely be some type of a hysterectomy. Again, we're going with minor incisions, endoscopic device, but we're also having the combination of also going through, in this case, a natural opening. And then the final surgical event is a external approach, which is performed directly on the skin or a mucous membrane. So this illustration in your textbook is showing a patient having a tonsillectomy, where the physician is going to open the mouth, and typically they would put a block here to keep the mouth from closing, and they're going to use a scalpel to remove the tonsils and then pull it off with the forceps. They're not cutting into the skin, they're just cutting it off of, or on, this particular case, the mucous membrane, which is the tonsil. So these pictures are actually in your textbook, but I will provide them again in your lesson 2 as a PDF. But as you are coding throughout the semester, please go back and refer to those pictures in chapter 2 or chapter 1 of those different surgical approaches, so you're matching up your clinical documentation with the picture so that you are choosing the right surgical approach. And then, of course, that's part of the code process. And again, as noted in your lesson 2, you have more information on the actual process of ICD-10 PCS coding. But before you can begin coding, you have to understand to some degree and become somewhat familiar with the elements of the system, the coding system, and then as you work with it in code, you will become much more comfortable. But I hope this presentation was helpful. If you have any questions,